This is our exam room. The equipment needed. As you can see here, it's a mess and there are not all the devices we need. You can see in each of these shelves that there are labels, yet the things with the labels are not where they belong. And there are shelves without labels on them. I'd like to have a Band-Aid or some alcohol pads and Vacutainers. Unfortunately, not all the drawers are full. We used to keep a monthly exam room checklist up to date on this. Unfortunately, no one has checked it in months, and we're dealing with a large amount of oversupply and extra storage in rooms. I don't think these bulb syringes have been used in 4 years. In each of the rooms, what we're going to do is label where each of our items belongs. So we'll show you where they go in just a second. So one of the things we begin to do is identify the labels and start to place things in their place. As you can see, we're missing some things. And by seeing it there, we know that we're missing them. And these visual cues are important to know that we're missing all of our tools. Because if you can't see it, you can't identify the defect. Good morning. So it's a Saturday morning. No one's in the office. I'm going to show you what we've been working on here with the labeling system to make sure that we can easily identify all the things that we need to identify in the room, examination style, so that way we don't have to shuffle around for stuff and make it a lot quicker and easier. Here, let me give you a look. So here we are in our cabinets. This is literally our manufacturing space for patients. Different things that we have or need. Removing earwax, giving injections, taking vital signs. And one of the things we thought about was the process with which the patients are roomed. And the nurses can start in with their vital signs, put some gloves on. Where's the thermometer go? Right here. That's right. Real simple and easy for them. Blood pressure cuff goes right there too. We've labeled everything up here so that way you can know approaching how to handle things. We used clear containers here so that way you can see how much of each item is in here. Ah, look. If we can see the label, it needs to be refilled. Tongue depressors, we need more tongue depressors. Simple and easy. It's obvious visibly that we're missing an otoscope here. Where is it? Where's the handle? I can tell you right now it's in back getting charged. But when we walk through the rooms, we can see immediately what we're missing. We're missing some sheets. Oh, our handout folders are missing. Guess what? We'll need to finish preparing them. And I'll talk to you a little bit about handout folders in short order. One of the most important parts about systematizing your work is making sure you have your tools right where you need them. Now, some people may complain that this is less elegant, or maybe it looks bulky, but I have to tell you right now, the speed and efficiency with which our nurses and our doctors can go through the rooms is key. It's essential. All of our clinicians and practitioners need to have access to tools quickly. And when the patient cries, we need access to tissues right away. So there are some quick systems here that we have in place to just systematize our ability to restock the room each day. So you remember the first room I showed you that was filled with biohazard waste? That's all gone. We've removed that. We've removed bulky waste. We've moved things where they need to go. We've made our space more efficient with effective labeling and a visual cue system so we know when to replace things. This is our room with all the things that we need and all the tools that we need to take care of patients. A much better space for everyone to work in, and much easier with everything labeled appropriately. Listen, every day, little improvements, and we will all get better together.